And I presented the patient for a treatment plan of $35,000. It got me out of the fear of the blood and the gore. Initially, when I started working in Australia, within a year of doing that, I went and did a year-long dedicated course for dental implant in North Sydney. And that course actually gave me a massive exposure to the surgical aspect of dentistry. I was quite a restorative dentist because I practiced for a few years in India because I graduated in 2003. So I had practiced in India for 4 years before I started preparing for the dental council exams. And I was quite a restorative dentist then. But when I went on to do this dental implant course is when I was really exposed to the surgical aspect of it. And it was a year-long course of dental implants. Like as I said, it involved both doing the restorative, which is the crown as we see, the white part of the tooth. And it also involved surgical, like placing the screw in the bone. Interestingly, what that course did when I came out of it, and I would always come, and like as I said, by then, we were doing it. Tanu was preparing for her dental council exams as well. And we will constantly be talking about it. We were discussing it through. And what came out of it from our discussion was, this is a procedure, and I will get a bit clinical in this, and I'm not sure if this should be the part of this discussion or not. But what actually happened was, it got me out of the fear of the blood and the gore, you know what I mean? Like, it gave me the confidence that, and there was a very interesting saying that professor then, who was my mentor for that course, he said, if you know how to close something up, you can open it. You are allowed to open it. You just have to know how to close it. So if you knew surgically how you could close a site, you could go and approach any type of surgery, obviously within the realms of a general dentist. I'm not a specialist dentist, but I'm not a specialist surgeon, but I am a general dentist with special interests in surgery. And interestingly, from that course, I took on doing wisdom teeth surgery, which was like a lot of people think, oh, Sanjiv, you went on to do an implant course, but you started doing wisdom teeth surgery after that. And I was like, look, the main reason for that is that it exposed me to how to expose the bone, how to deal with any nasty situation, like if there is like a little extra bleed or something like that. How can you handle that? How do you actually feel when you actually take the tooth out and you see a nerve passing in the bone? I must say that surgery initially is not for the faint-hearted. It does give you a bit of a shock, But then once you have done that, when you are exposed to that, it is it is very addictive. It is very addictive. So that I would easily say implant dentistry would be one of the biggest things. As an associate dentist as well, actually, I went on to do a couple of management courses, as in a dental practice management courses. And that was the time. Look, I always, even when I was practicing in India, I must say that I was always inclined to explaining patients. Just to give you a bit of a background, my dad, he specialized in the national language, Hindi. He was a specialist of that. So he was very, very expressive, a fantastic orator. He talks really, really well. And I always try to, he has been my hero forever. Just to let you guys know, anyone asks me who's your childhood hero, it's my dad. He is my hero. So I always try to follow his footprints. So I was always in the favor of, okay, if I'm providing a treatment to the patient, then I'm actually telling them what I'm doing. I'm explaining it to them. And that I was doing all through the time. But when I went on to do these practice management courses, that's when I got an exposure to understanding this, that when you are actually talking to a patient, it is not about just blabbering your clinical knowledge to them. It's not like a mix of dental jargons that you are just explaining it to them for the sake of you wanting to tell them, but it is more important for them to understand it. So you got to give the analogies, you got to give them the metaphors, you got to give them and explain them in a way that they can understand that. And that is where the communication part of the thing that got into my head, and I thought, oh my God, this can be a game changer. This can be a massive thing. And I remember and again, sorry, I keep coming to that, Sadi, and I will mention that, is that I came back from the course. I have always been of that thought that, whatever you get trained for, you got to practice that. You got to put that to practice straight away. I cannot imagine, or I can't understand how people go through the whole course of doing something. Like, I know people who were doing implant courses with me. They did 2 years of implant postgraduate training, and they did not place one implant in the patient's mouth. They said, okay, we will wait, we will finish the course, we will learn more, and then we will place the implant. I have been dead against. I always put something to practice as soon as that I learn, because I feel that practice is what, as we all know, practice makes it perfect. So that's what. So when I came back from that management course, I did a planning for the patient. I did the whole treatment planning, and I presented my patient a treatment plan. And I will mention it just for the understanding's sake, that I presented the patient for a treatment plan of $35,000. I printed it off at the front desk. I was in the room. I hit print, and it printed out at the front desk. And my receptionist printed it. And I could hear them laughing in my room. From the reception, they were like laughing. They were laughing their heart out. They were like, Dr. Pathak's gone crazy. He doesn't know. No one accepts this sort of treatment, Who does? Because up until then, what we were doing is the maximum plans we were giving to the patients was for $4,000-$5,000, And now that I was trained for this and I wanted to put that to practice, to everyone's surprise, in 2 weeks' time, the patient called back, accepted the treatment, and wanted to go ahead. Okay. And that, I feel that was the game changer. And honestly, because it was the first time I was doing such a big plan as well, when the patient came, that actually gave me the confidence that I am actually capable of doing something like this. And I must say that I still remember, I've seen quite a few patients, hundreds of thousands of patients since then who have done big planning on, but I still remember his name very clearly. I know what treatment I did. And look, I think that was a big learning experience from there. So that I would say that it would easily go down as the second one. I did the postgraduate diploma with the dental implants with the Charles Sturt University, as I had mentioned. That was a game changer in the way I would say that it was actually learning a different education system. Because like as I said, I did my dentistry in India. I did the dental council exams. But all of these things was a lot of reading from the book. Whereas in the postgraduate diploma, when I was going through that for the 2 years of that training, as I was mentioning, that is when I was actually exposed to the Australian way of education, which was a lot research-based. So that actually exposed me to running, to starting to read dental journals and to read articles and things like that. And that is where it was all starting to become evidence-based, like randomized controlled trials, or you are actually not relying on a word of mouth, not relying on what an expert says. Not case reports, but actually a systematic review that you are reading. You are actually reading reviews, and your knowledge growing from a group of articles that you are reading, and getting to the cutting edge, the bleeding edge, knowing what is happening the latest and what is the accepted norm. So that was definitely a great learning experience in terms of starting to look at what you are doing from more research-based perspective. Then I actually forgot to mention that earlier, was that I actually, I would say that one big learning for me was when I did my joint membership of the joint dental faculty from United Kingdom. I went there. So I've also got an MJDF, which is the membership of the joint dental faculty for UK and Australia. So I went and did that exam in Manchester. And that was actually quite an experience. The whole training and learning for that degree. And also when I actually went on to do the exam, because this was again, I did my ADC back in 2008. Now, this was something that I was doing in 2016, 2017, which is like 7, 8 years of practicing as a dentist. And then all of a sudden you go on to do an exam. And it was again the same thing, they used to have 2 sets of training sessions happening in Leeds and in Manchester every weekend. And people will go and do that training, and then they will go and do the exams, and they will take like 4 or 5 attempts to it. And here I was, I planned a Europe trip, and I thought I will start with Manchester, do the exam first, and do the whole thing. I went on to do the exam, and thankfully it was a great experience, great learning experience, and I passed the exam, which came as an absolute surprise to me, because I had not done any training for this exam. But it was a great learning experience in terms of how they actually had structured the exam, the whole learning process of that. It was very clinically oriented, but it was actually a mix of the two. It was clinically oriented as well as academic, a lot of research-based papers on it. So that helped a lot with that. I did do a bit of training with orthodontics, I must say, which has helped me a lot in terms of, and I did actually 2 years of comprehensive orthodontic training, which has helped me a lot with my treatment planning. I use that modality a lot to be able to plan the cases comprehensively, because it gives me the angle to look at in the light of that. I must say that I still refer to my specialist orthodontist, or I still refer to my wife as a reference, because she is actually going through a postgraduate diploma at the moment with orthodontics. So I still refer to her for that. But that has definitely helped me with my comprehensive planning of the cases that I do. So I would easily say that these would be my 5 major learning perspectives from when I started.
Get on your knees, came from the jungle, up in the trees. I got a few tricks up in the sleeve. One wrong move, I'ma let out the big shoes, check out the crease. Blow like I'm Bigfoot, step on the beat. Make a man's run till he step out the crease. When the whole place scream, gotta get